this is Dr. Meaghan
And Dr. Mark.
from Agora Integrative Health. And on this video, what we wanted to really discuss is SIBO. So we wanted to talk about SIBO, which stands for Small Intestinal Bacterial Overgrowth. It is a common dysfunction that we find in individuals that we've treated for a really long time. And I do believe that we have some of the best results out there because of our approach. So we wanted to sort of break this all down and go through it so that people could understand what it is, why people should take sort of a functional medicine approach, how we approach it, and really provide the tools there to better educate and treat individuals. So I think a good place to start is what exactly is SIBO?
Right. So it's small intestinal bacterial overgrowth, right? So, and it can be caused by a number of different things, but the way that we usually see it, it's stress induced, right? So the way functional medicine looks at it, it's mental, chemical, physical, right? So a lot of people are under a ton of stress, and when you get stressed, you have a psychovisceral response, messes up your gut, and then it becomes a perfect playground for the bad bacteria to take hold.
One thing that I always say to patients that I think is missed with SIBO is that it's a digestive issue and a neurological issue.
Yep.
And because these symptoms are so digestive based, people a lot of times will get stuck in, well, how do I treat the digestive dysfunction? You know, either there's antibiotics you can go on, there's herbs you can go on, but they never address that neurological dysfunction that occurs across the board with SIBO. Whether it's like you said, whether it's high levels of stress, a concussion, or just this perfect storm that nervous system's gone down, people go into fight or flight, they get out of rest and digest, and then what happens is they create this SIBO environment. But to get people out of it, we have to then go after the digestive and the neurological.
Yeah, and because we've been doing this for like 7 years, something like that.
Like really been treating it pretty aggressively for 7.
And the way we used to do it, you used to prescribe antibiotics, right? And you could, because we ran the test, you saw that it was positive, you prescribed the medication, whatever, and then they were negative, everything's good. 6 months later, they're right back in it.
Yeah.
And it's like, well, but you fixed it and didn't
We
work,
got what we
right?
hate,
So,
which is revolving door patients.
Yep. So it's very Western medicine. So it's like, oh, what happened? So then we added in like FSM, and it's like, okay, that gets a little longer, and now we added a whole bunch of other stuff. But yeah, it's kind of, yeah.
So FSM, I think, is one of the gold standards of treatment that we've really started to incorporate and have seen the difference in the last 7 years of how we've treated this versus what we did before, which that stands for frequency specific microcurrent. Mark uses this a ton with patients and uses it to decrease inflammation, rebuild the brain-gut connection, and really improve the vagus nerve. So talk a little bit about that and why you think that makes a big difference and how we approach it.
Because it goes, it kind of matches up the subjective with objective, right? So there's a little spot on halfway between your belly button and hip pointer on the right side. It's called your ileocecal valve. And that's super important to us because that's where the small intestine, large intestine meets up, right? So if we push there and it hurts, that's a really good indicator that you're inflamed, right? So we push on that first, then we set you up on the FSM. Usually takes like a half hour. We set it to like viscera, small intestine, large intestine, stomach, all that kind of stuff. And then afterwards, then we poke it. We see if did it decrease inflammation. It's like, okay, usually, 50% reduction, that's good, that kind of thing.
And an easy way to think of that is structure's always going to reflect function. So, just like if your bicep isn't working right and it's, tight and not able to contract like it should, what we want to do is get that inflammation down for better function. And so it's great with a frequency specific microcurrent because what you can see almost immediately is that inflammation goes down, the tension goes down, and people feel that. And then what happens is that restores proper function. And then if we stack the other therapies on top of it, we can really get people out of these abnormal patterns.
Yeah. So yeah, it's probably my favorite room in Agora, but it's called the parasympathetic room, right? So we try to get you from fight or flight into rest and digest. So FSM is one of the things we set you up on, and then we have a beamer mat, right? So it's a pulse electromagnetic field. Basically it bounces out your positive, negative ions, helps with blood flow and circulation, all that kind of stuff. But that'll help you get into parasympathetics. And then we also laser your brain with it's called an FX635. So it uses 635 nanometer photons. The whole idea with that is anytime tissue gets injured, the mitochondria curls up like a little porcupine, and it slows way down making ATP, or the energy currency for the body, right? So that photon hits the mitochondria, pops back open, starts making a ton of ATP. So we're just flooding the brain with a ton of healing potential. So we decrease inflammation in the gut, balance out the positive, negative ions, and then flood the brain with hemo potential. And then the last thing we do, we have a purple laser, and we laser your vagus nerve. So reconnect the whole piece. And that seems to be getting the best results
like
with it.
It's just been night and day difference. And so a lot of people too, if you've treated SIBO, you know, and really wherever you are in the journey, we really find that you can come in and have great results, because whether or not you think you have it, we obviously can do the assessments, the tests, you know, Dr. Mark does that a ton. Even if you think you have other GI issues, they fall into this category too, so we can help rule out and sort of look at, is it SIBO, is this other gut issues, is it both? We see that a lot too. You know, if you've been treated other places and you feel like, and especially, you know, if you look online with SIBO, you'll see that people always say it's sort of this revolving door, and it's that, you know, I got better and then I didn't, and they just feel like they're on this sort of merry-go-round roller coaster ride. And if that's the case, I mean, those are the patients I think we thrive with, because you really do have to take this full comprehensive approach. And the thing that I see that Dr. Mark does the best is he really does, like what he was just talking about with the cells, is you get somebody out of this, you know, sympathetic fight or flight, cells closed down, they're in like fetal position, so they're not able to communicate and respond to the environment. They're not producing ATP. Just like if you're a, you know, scared individual in the fetal position in the corner of the room, you're not interacting with the environment. You're not, you know, playing and having fun and like thriving in that environment. You're just trying to survive. And the treatments that Dr. Mark does, you know, to be able to really comprehensively go after this, you get those cells to start to thrive again.
Yep.
And get people out of this sort of survival shutdown mode that happens so much with SIBO. And so really by taking this comprehensive approach, it just makes all the difference in the world.
Yep.
So if you guys do want to know more about SIBO, I know there's a lot of information on our website. You can definitely reach out to us at info@oneagorahealth.com. And also through the website, you can, you know, send us a message. But this is one of our passions. I honestly have worked now with Dr. Mark for 9-10 years.
Yep.
And just have to say that, you know, really, you know, this is one of the ways that I think he thrives, is being able to really put this together, and not only thrives, but I mean, you've just worked so much with individuals too, that I know this has become one of your passions.
Well, it's super fun because it actually gives them their life back. It's like, oh, we can adjust people and those kind of things, and that's more a revolving door. But like when you actually see their serotonin turn back on, and they're actually enjoying life again, and they're actually doing things like, I haven't done that in 2 years. Like, it's like, that's like super cool. So.
One other thing I wanted to piggyback on that is, I know the other thing about SIBO is that so many people go on super restrictive diets.
Yep.
And though there's a time and place sometimes for that, like the other thing that we find is that if it's a restrictive diet that's maintaining your symptoms, then you're not dealing with the underlying cause and putting back together this, you know, brain-body connection and going after SIBO and really connecting the digestive system to the nervous system. You're just decreasing the symptoms with that diet. So our other favorite thing is, you know, to really fix the problem, get the foods back, get people back a quality of life too, where they're not ruled by their diet.
Yep.
And so, yeah, just really, you know, we see changes all across the board. And so this really is something that, you know, we want to educate more people on, because our approach is different. It's evolved with having to treat a lot of patients and putting together what's been missing and really getting somebody's life back.
Yeah,
so
absolutely.
Thanks guys for listening. And like I said, reach out with any questions or concerns.